Hi, welcome to SCRT Samagra. Today's topic is prescription abbreviations. If you see QD in a prescription, then that means once daily. It came from the Latin word quoque and die. BID in a prescription, that means twice daily. It came from the Latin word bis in die. TAD stands for three times daily. It came from the Latin word ter in die. QID means you need to administer the medication 4 times daily. It came from the Latin word quarter in die. Q4H means medication need to administer every 4 hourly. The Latin word is quoque for hora. Q6H means you need to administer the medication every 6 hourly. Q8H means every 8 hourly need to administer. OD means once daily. If you see HS, that means medication need to administer at bedtime. It came from the Latin word hora somni. PRN stands for as needed. It came from the Latin word pro renata. So whenever patient have pain medication need to administer. It's not the fixed time as per the request of the patient. So if for the vomiting medication, whenever needed, whenever the indication is there, you need to administer the medication. Stat means you need to administer the medication immediately. It came from the Latin word statim. Next, abbreviation related to the route of administration. If you see PO, that means medication need to administer by mouth or orally. IV stand for intravenous injections. IM stand for intramuscular injections. SC or SQ stand for subcutaneous injections. If you see SL, that means sublingual. Medication need to put under the tongue. PR stand for per rectal. You need to administer or insert the medication into rectum. PV stand for vaginally. Medication need to administer through vagina. These medications are known as pessaries. So pessaries you need to administer through the vagina. Medication that is inserted to the rectum, it's called suppository. So suppositories are administered through the rectum. TOP stand for topical use. INH stand for inhalations. Next, dosage and instruction related abbreviations in the prescription. If you see mg, that is milligram. G stand for gram. MCG stand for microgram. ml stand for milliliter. TAB stand for tablet. CAP stand for capsule. SYR stand for syrup. SUSP stand for suspensions. If you see AC, that means medication need to administer before food. This came from Latin word anticipum. PC in a prescription, that means medication need to administer after the food. It came from the Latin word postcipum. NPO, that means nothing by oral. It came from the Latin word nil per os. That means before the procedure, patient should not take anything through the mouth. So in order to avoid the medication error, each prescription need to check properly. If anything is unclear, always confirm, never assume. Always make sure the patient details, patient age, allergy, patient condition. Next, check the drug. Any doubt regarding the lookalike medications or confusing medications, or is it correct medication for the patients, or it's underdose. Anything related to the dosage you need to check. Make sure the drug is correct, dose is correct, there is any interactions or drug interactions, everything we need to make sure. Next, you need to make sure this is the proper route, whether the medication is prescribed by oral or IV or injections or rectal, topical, which route is medication prescription came. So make sure before you administer, make sure that this is you are injecting or you are administering the medication at the correct site. Next, time and frequency. Always make sure the medication is administered at the correct interval. Also, make sure the interactions, double check the patient conditions and check the drug-drug interactions or drug-food interactions or drug-disease interactions. If you have any doubt, always make sure that you confirm with the prescriber topic.